is unique and every journey matters. It is October, that means it's Breast Cancer Awareness Month. And as the world turns pink, the reminder is clear that behind every statistic, there is a face, there is a voice, and there is a journey of resilience. This morning, we are at the HCG Cancer Center right here in Parklands, and we are about to talk about breast cancer and everything that you need to know in regards to this particular condition, which is globally the most diagnosed cancer, right? And it is said that in Kenya, it is the second leading cancer. Yet, very few women show up for screening. So, have you had your breasts checked this month? This is your sign. This is Morning Cafe. Karibu sana. All right, now this morning I'm joined by Dr. Adash Chandra, a clinical oncologist at HCG Center, where we are this morning. And of course, Mr. David Makumi, CEO of Faraja Cancer Support Trust, and will be telling us more about cancer care and in regards to breast cancer. This is Breast Cancer Awareness Month. Once again, if you're just joining us, and that is the conversation we're having this morning. Karibu sana to Morning Cafe, NTTV 47. You're well?
Thank you.
All right, I just want us to set the pace for this conversation as we start. HCG Center, you pride yourself in being the world's leading cancer center. What are you doing different?
So we are like HCG Cancer Center, as it's a as HCG is a chain of hospitals from India. So they have more. It's one of the biggest cancer network in India. So HCG CCK is the one of their branch. So as with the remaining branches with HCG in India, so our center is equipped with the latest radiation treatment techniques, the machine. It's called Electra Versatility, which is able to do all high-end treatment, what we see in other developed countries.
Is it the only one in Kenya which is able to do that?
So now we are the only one who are offering the high-end treatment like IGRT, SBRT. We are the only center who are offering.
Great. Mr. Makumi, talk to us about Faraja Cancer Support Trust as we start. What it is about? What is it about?
Yeah, Faraja Cancer Support Trust is actually a cancer charity that runs programs around the country, and we focus on holistic care. In addition to what patients need, chemotherapy, radiotherapy, and surgery, there are major psychosocial issues associated with the cancer diagnosis. We journey with the patients to enable them face the distress of either the treatment or even the disease itself. Once a patient or a family hears that they have cancer, the associated mental distress is huge. And we run programs where we have breast cancer support groups. We have one of the most vibrant support groups in the country, where people with breast cancer, all men and women as well, come together once a month to network, to support each other, and to provide, peer support to each other. We also run support groups for many other cancers, in addition to also assisting patients, especially those who are unable to complete their treatment because of financial challenges, or even to start, or even having challenges paying their social health insurance. We come in for patients, whether they are getting their treatment at HCG or whether they are getting their treatment in Coast General in Mombasa or in Garissa or anywhere around the country. We journey with the patients.
So how far spread are you across the country as it stands? Are you only domiciled right here at HCG Center? Because I understand you've talked about your services being spread across for anybody who wants to seek treatment anywhere across the country. But your offices, how far spread are you?
Yes, our physical presence is right here, and HCG has been gracious enough to provide us with a physical space where we run many of our programs. But one, our programs also run virtually. So there are patients who actually want to talk to a counselor, have virtual counseling. There are patients around the country and beyond who join our support groups virtually. We just share a link and patients can actually join in addition to those who physically come here. We have a physical presence in Eldoret, at MTRH, where we have staff again, who look after patients in that region. But for the other programs that we run the programs sending our teams to the major national referral hospitals to support patients and families through or navigate them through various aspects of cancer care. Because essentially, when a patient is undergoing radiotherapy, I'm sure Dr. will be telling us about that.
Right.
There are many other questions that they may not have time to ask when they make a clinic visit. And that is where we come in. There are also a lot of myths and misconceptions out there around breast cancer. And that is again where we come in. Faraja Cancer Support Trust was actually founded by a breast cancer survivor herself to provide this kind of holistic support to help patients' journey. You know, a patient may actually be on chemo, they may be on radio, but they are still very sad, even when they have the finances to pay for that treatment. Then you know, Dr. would wonder, but why are they not, you know, they have the money, they are getting the best treatment in the world, but they are still mentally distraught. And that is again where we come in, because there could be many other issues going on, either stigma in the community, rejection by family, isolation.
So the gap for the formation of this Faraja Cancer Center was more about the community support for patients with breast cancer and survivors. Right. It's Breast Cancer Awareness Month this month, and the theme you're working with is every story is unique, every journey matters. Usually this month is known to be a pink month. We color it pink all over the world. But what does that mean to you medically?
You see, like breast cancer is one of the major cancer bulk. We have like not only in Kenya, it's globally, it's the leading number one cancer worldwide. So, and one of the things is, and it is, it affects both men and women. Though it is more in women, it can also affect the men. Okay, and it's a curable cancer. Okay, so I think, yeah, it's quite important, the breast cancer, to address properly. And it is like we can detect, there are even screening methods available for breast cancers. So we can detect them early, we can remove, we can show it as a, like, we can remove the stigma around it. So because it's a curable cancer, we can give an example for all the patients suffering with other cancers that it can be curable.
So how do you relate to this theme? Every story is unique, every journey matters.
Definitely, yes. You see, breast cancer, we have different types of breast cancer. As such, if you consider, we have we have hormone receptor positive breast cancer, we have hormone receptor negative breast cancer, we have HER2 positive breast cancer, we have triple negative breast cancer. So again, I told we have cancer in men, breast cancer in men, breast cancer in women, and each patient, how they respond, the chance of recurrence, everything is different. For each patient, it is different. So again, yeah, how we approach, there are many treatment modalities we use here. So each patient having different stories of treatment, how they overcome these treatment challenges, the side effects, overall cancer. So I think everyone's story is different.
All right. And Mr. Makumi, I know you're going to give us survivor's touch on this. We're working with every story is unique, every journey matters for this theme. I know you've interacted with most women. I don't know if you'll tell us if you've interacted with men as well, but how do they relate to this theme and what does it mean to you? Every story is unique, every journey matters.
Yes, yeah, and I think that's very aligns very well with with what we do here at Faraja, at Faraja, because every patient who comes seeking our support or seeking to speak to our therapists, they have a very unique story. And in the context of breast cancer, even if you are to take 10 women with breast cancer, their journeys are very different. Their reactions are very different. Even the amount of distress they face is very different. One patient may actually have very good support system within the family. You know, they'll be able to cope. They have probably the resources to get through their treatment. And maybe they are young and their cancer is maybe early. So that's one patient, but a different patient may even have very early disease, but they may not have the resources, they may not have the family support, but they may also not have the mental resilience, you know, to be able to cope with this. Some people cope pretty well. They get the initial shock of diagnosis, and you know, after the treatment plan is laid out, they say, look, I'm going to fight this, I'm going to overcome. So other patients, their story is very different.
Right.
They still be very fearful, even months in the treatment, even after completing the treatment, and they are told, look, you know, you are all clear, you have had all your treatment, they are still very, very fearful. And why it's in, the statement actually relates or resonates with us is because the interventions you plan for patient A and patient B and patient C are very different interventions, even though all of them are having breast cancer. You wouldn't have a one size fit all. And doctor will tell you even their treatment modalities and even their type of breast cancer for sure, if you even looked at the cells under a microscope, they may be very different because everyone will have a different disease, but even the socio-economic circumstances is very, very different. So we design solutions based on the story that the patient tells us and the journey they have been through. Some people will tell you, oh, I got a diagnosis. I mean, I found a lump 2 years ago, you know, and I didn't go to hospital because I wasn't feeling pain. Another person will say, I found a lump, and the following day I was sitting in front of a doctor. I panicked. You know, so
stories are different. Every journey is unique and different.
Every journey is unique.
But do you have men at Faraja Cancer Support Trust as well for breast cancer specifically?
Specific to breast cancer, yes. The number of men who have breast cancer is much lower, probably maybe 1% or maybe less thereabout. You know, of all breast cancer. So they are much fewer, but they are occasionally
at Faraja?
We get one or two who attend the support group. I know a couple of guys who occasionally come. Many men, even when they have a diagnosis, tend to shy away because unfortunately, you know, many of us are socialized to think breast cancer as a disease for women.
Right.
We talk of breast cancer, we're not talking of breast cancer in women, which is different because that is focused on a specific gender.
Right.
I mean, over the years, I've seen many men, when I ask them, look, you have been treated successfully, why don't you speak to other men with breast cancer? They say, no, I don't want to talk about it because then, you know, it's supposed to be a disease for women. It's a disease for all. Yeah.
And Dr. Dash, why do you think there's a disparity in terms of information when it comes to breast cancer? Most men don't know that they can as well get breast cancer. Then why do you think there's such disparity?
Yeah, I think maybe the awareness. Yeah, so most of the time, breast is also synonymous with women. So the lack of awareness. So though everywhere we speak about the breast cancer can happen in men. So though the incidence is quite low. Yeah. So
how prevalent are the cases that we see right here in the country?
So like it is quite less, but like as he told, like it is around 2 to 3% like that.
All right.
Among every 100 women we see, maybe one man. Yeah.
And I want us to still just stick to that even as we continue to create awareness about breast cancer in men as well. But what are the signs to look out for in men?
So you see, it's similar, like anything related to a lump in the chest area, the breast area, or even in the armpit. Any change in the skin around the chest area, the breast area, or it could be ulceration of the nipple. All these are the pain, which is long-standing pain. All these are the signs and symptoms. Any progressive swelling in the breast area or in the armpit, okay, it has to be evaluated to be examined for the signs of breast cancer.
That cuts across men and women, or is it specifically for the men at this point?
It is both similar. Even it is the symptoms of appearance, what we look for, how we manage, everything is similar. There is no much difference how we treat a woman with breast cancer as well as men with breast cancer. They have to go through all the treatment modalities.
And Mr. Mukami, sometimes the conversation is around, men, we do not have breasts. Then how do you demystify that notion? Because they say when you tell somebody you can go screening for breast cancer if you're a man, and they say, no, we do not have breasts. I've had such a conversation. I don't know if you've come across something like that. Have you?
Men do have breasts.
Yes.
And even we men know we have breasts. The difference is the amount of breast tissue.
Yeah.
The breast tissue in men is not as much as in women, but we have breast, we have nipple. The tissue is much less, and obviously for a man to spot a lump, a swelling, it's much easier because the breast tissue is very, very little. So it's very easy for a man to say, yeah, I haven't been feeling this little swelling under the skin, or I have noticing something unusual. We always tell people, two things. Look, just be familiar. How do they look like? Be very able to spot a change on the surface, and also feel. Is there a feeling? I haven't been feeling this swelling, then it needs to be checked. Importantly, because it may not necessarily be painful, but it's not been there. It needs to be checked. And most of that, maybe it could be something else. There are many breast diseases, but then cancer is one of the many, and you don't want it to be that. Some people may say maybe they have a lymph node under the armpit, that's swelling under the armpit. And it also needs to be checked. Is a lymph node, they can feel a little swelling that hasn't been there, because of the breast tissue being very minimal in men. The spread is much more faster, and I'm sure that Dr. will elaborate on that. It's much more faster, so they need to have that checkout. One of the biggest problems we have is the health-seeking behavior for men.
Right.
It's vastly different from women. Men just don't. We are very stoic. We believe, I'm a man, I can, I can ride through this. This macho thing of the men, it's pretty much what is affecting our health. So we need to make or normalize as men health checkups. Normalize checking with your doctor if something is unusual, even if it is on your breasts. It's so the breast cancer and breast disease, it's not a women thing. It's an all of society problem.
Right.
So we need to seek advice.
And medical attention. Right. Yeah. And Mr. Mukami is talking about sometimes for men it's easier for the lymph node to spread. Chris, I think the breast area, the chest area. How about women?
So it is like normally breast, when it comes to breast, it consists of two parts. Like one is the fat tissue, the other one is glands. Glands has the lobules where the milk is made, and there are ducts which the milk which is made, which is it travels through the ducts and it is given to the nipple for the feeding purpose. Okay, though in men it is rudimentary. Rudimentary is non-functional. So in women it is well developed. Okay, and as Dr. Mukami, our colleague told, so now like in men the amount of fat tissue is less, as well as the gland. The gland is rudimentary; it is not functional. Okay, so again in the women also, like normally the spread of the breast, as I told, the cancer normally arises from the ducts, either from the ducts or the lobules. Usually not from the fat. Okay, this cancer, it can spread locally inside the breast tissue. It can involve the surrounding structures like the skin, the chest wall, as it grows further, and it can also spread through the lymphatic. There is something called lymphatics, the lymph nodes, which normally it spread to the armpit. There are certain lymph nodes in between the breast. It's called internal memory nodes. There are also lymph nodes below the neck, the lower part of the neck. Okay, normally these are the areas the lymph nodes spread. The tumor can spread through the lymphatics. It can also spread through blood to different tissues. So it is in women also it is quite common. Depending on the extent, location, these lymph nodes they're affected. Yeah.
And of course, before somebody comes to the hospital, one cannot wait for it to spread that much. That would be cause for alarm, right? But now the question would be, when it's still around the breast area, is it usually painful?
So it may not be painful. Most of the breast swellings are not painful at initial setting. But again, it depends if it is associated with, if there is any nerve involved, it can be painful. Okay. Or at the same time, if it is associated with any infection, it can become painful. It can occur together, like the infection part of the breast, the growth could be infected, so it can cause pain. But most of the pain, most of the cancers, they are painless to start with.
And Mr. Mukemi, from the people that, of course, you interact with at Faraja Cancer Support Trust, how long did it take them, or maybe for them to get this treatment or to seek medical attention? Because maybe sometimes they feel there is a lump or there's a lymph node, they feel something quite hard on their breast area, but now they could ignore, they're in denial, the stages of grief. Then how do they tell you, how long did it take them for them to seek medical attention?
Yeah, I think good question, very good actually, because you can look at it from two different aspects. One, there's an element of the first time they felt something, and when they actually had an encounter with a health worker, with a hospital, with a health center. You know, there are people who will have had that for 3 months, even 6 months. You know, they felt a lump, but maybe they passed it on, or they consulted a neighbor, or they just didn't do anything about it because it wasn't painful. There are those who will very, very promptly feel a lump. The following morning they are seeing a doctor, or they are seeing a health worker. They are concerned. And for women, you know, women have a lot more encounters with the healthcare system than men. Maybe they are taking their babies for vaccination, so they may have an opportunity to point out the concerns that they have, maybe regarding their breast health, if they have felt something. But there is also those who will present to the healthcare system, and the healthcare system also lets them down. You know, maybe they have a lump, and if they are in the periphery somewhere, either their concerns are not taken with the weight they deserve, and you'll find that by the time they get a proper diagnosis, it may be a whole year of going around the hospitals. They've been to this health center, they've been to this sub-county hospital, but no one has actually sat to figure out what is going on. And some patients it will be a year. Not because they didn't have an encounter with the care system, but because maybe the care hasn't been very well coordinated. And so you'll find patients may come to Daktari and they say, well, I've had this problem for the last 1 year, for 6 months. Yesterday I met a lady from one of the counties. She works for a family, and she has had a lump for 2 years. The first time she noticed the lump is 2 years ago.
So a lump is cancerous?
No.
A lump
may not be.
Not
It's not.
necessarily?
No.
Okay.
9 out of 10 times it's not cancer.
Okay.
So, but then you need to figure what is it. Could be a benign, innocent lump. Not always. But in her case, by the time she got a diagnosis, she already had lymph nodes. She had, swollen and all the signs that Dr. was mentioning. But when I asked, so when is the very first time? That was 2 years ago. Meaning by then, if she was to be treated promptly, that treatment should even have completed. But now she has complications associated with the fact that she's not even being treated. And why? Because then she didn't have the money. When she was asked to do some of the tests, if you are doing a biopsy to know whether it's cancer or not, you need to pay for that. She didn't have that kind of money. And so she still went away. And now when it became increasingly painful, there is a wound and all this. Now it's almost like I need to get the treatment right now. And so that's a whole 2-year journey. You're talking about different journeys of going to a hospital and not really getting the definitive diagnosis and definitive treatment. So what we say to tell women and the men if there is alarm does not necessarily mean it is cancer. If you are doing your own self-breast examination, we talk of it as self-breast awareness. Just be breast aware. Being breast aware does not mean you are looking for cancer. You are just aware of your own breast health. So the problem you may have in the breast may not necessarily be cancer, but until you go and get it checked out, then you can't sit and assume it is not. Yeah. So the journeys and how long it takes, depending on whether you have money to pay for what is needed. By the time you are starting treatment, it may even be 8 months later. And you see that especially in the public sector, because you ask to do several tests. Like what that time you call staging workup. You need to do some X-rays, some scans, some blood tests to know where.
Diagnosis.
And we'll get right into it. Let's just take a very short break. Hold on to that thought. We'll be back in a short while. We're talking about Breast Cancer Awareness Month. How can you take care of yourself? Stay tuned. You're watching Morning Cafe.
No more excuses. It's time to rise, grind, and own your mornings. Join Coach Shadrach Ouma every Monday to Friday from 5:30 to 6 a.m. only on TV 47. Full body workouts, zero equipment, maximum results. Start strong, stay strong. TV 47 Fitness with Coach Shadrach only on TV 47. Looking for the perfect way to kick off your weekend?
Pole. Hiyo ni salamu ya Mluya kabisa.
Tune in to Friday with Betty, the most exciting show on TV.
Betty, one tear gas. Betty, I don't know where this guy's going.
Walikutoka.
From the latest news and trends to unforgettable moments.
Hiyo nao nakubali.
Wewe ni simpa.
Friday with Betty is your go-to show for a fabulous Friday night.
Theological, meteorologist. What is that word, Willis?
Tune in this and every Friday at 9 p.m. and let's make your Fridays unforgettable. Only on TV 47. Enjoy uninterrupted live streaming of your favorite programs on TV 47 and Radio 47 on the go with our new mobile-friendly website. Experience the future of broadcasting. Visit www.tv47.digital or scan this QR code and stream your way to endless news and entertainment. Welcome to the home of untold stories.
All right, welcome back to the show. Thank you so much for staying with us. You're watching Morning Cafe, and this morning we're talking about breast cancer in commemoration of Breast Cancer Awareness Month. It's October. That means the world is turning pink to celebrate both men and women. As you've already heard, that even men can actually have breast cancer. Now, just from where we left it, we were talking about a lump on the breast not necessarily being cancerous, then at what point do I need to seek medical attention? If I feel a lump cannot be cancerous, then what is it?
Okay, so normally lumps in breast are common. So there is something called fibrocystic diseases of the breast, where like there are different types of like there could be some issue with the ducts or the lobules of the breast. Normally there is something called fibroadenoma, which is most common in young women, young ladies. So, but it's a kind of benign lump. So that kind of lump, it doesn't grow further. Like the patient can have a small lump, okay. So, but it doesn't grow alarmingly, or it doesn't involve the surrounding structures. It doesn't spread. Okay. At the same time, we have though cancer is a disease of the elder age, as you grow old, the breast cancer is more common. But we have seen the breast cancers even in younger women as young as 20. I have seen patients with breast cancer. So normally any lump which is there for longer time, which is growing in size, okay, and it is bringing some changes in the breast. Okay. There is also it is you can feel the lump in the armpit, the lump in the breast and lump in the armpit. It should be alarming, like it should be checked. Any breast lump has to be checked, even it is a benign or cancerous, it has to be checked. Particularly these are the signs of cancer. The lump which is there, which is growing in size, which is not decreasing, which is growing in size and causing new symptoms, or even you can see some lump which is arising in the armpit. So it could be alarming. It should be checked.
All right, and I don't want viewers to be, to be kukona woga. I don't want them to be scared, right?
Okay.
And we're talking about these lumps that are there. So does it mean that the breast has to be soft entirely with no feel of any hardness in it?
You see, like again, the consistency of the breast can vary from one person to the other person. Normal glands can also feel like slight lumps sometimes for some people. So it is not like, it has to be checked. If they feel it is not abnormal, not normal, it has to be checked by an expert, a surgeon or any doctor, per se, a gynec or somebody. The first person of contact, or what the medical personnel of contact, they have to get it checked. Okay. But as I told, for some patients, the normal breast itself can feel like a nodular. Nodular means they feel like a little bit bumpy. The whole breast they can feel. Okay. So again, some of the breast lumps could be, particularly in young women, it could be something called fibroadenoma, which is not cancerous. Okay. Yeah. So, but it's good to be checked, just to rule out a small percentage of chances of cancer having.
Okay. Talk to us about self-medication, because you brought that up, Mr. Makumi. How exactly do we do it? Because we've been told, that sometimes, you can go to the mirror and you can actually see if there's a lump, and not necessarily try and self-medicate or self-diagnose yourself, but how do we now do that self-check?
Yeah, it's important that we are very well, I call it more being self-aware.
Right.
And when it comes specific to breasts, breast self-awareness for your own breast health, we are not even talking cancer here, just breast health, it's important for you to one, know how your breasts look like. Whether you are a man or a woman for that matter, you can do that by simply standing in front of a mirror. You know how they look like.
Yeah.
And many women will tell you in one of the breasts, it may be slightly larger than the other, just may appear, but it's important that you just sort of internalize, how do your breasts look like? You can stand in front of a mirror, we say what Hansa Kimbo, just stand in front of a mirror and be able to internalize the look. Why that is important is that if there's changes in the skin color, maybe some dimpling, if there are any specific changes that have not been there, you'll be able to say, well, when I look at the mirror, myself at the mirror, I'm able to see some changes that have not been there, though they need to be checked, And the other thing is how they feel like. So the look and feel is important. How do they feel like? And that is where you want to use their hands,
right?
The opposite hand for the opposite breast. So you examine the right breast with the left hand. You may start off. We try not to make it so rigid, like you must follow
a rhythm.
Yeah, for a very, very specific, so that the woman or the man,
right,
whoever is examined, does not feel like I didn't do it properly. But once you potentially then start from the nipple area and walk around in a circular motion around the breast, working all the areas with an open palm,
right,
fingers together. So starting from the nipple all the way around, and while you're doing that, it's important to have your hand,
up,
either stretched, yes, up, because you could do this even when you're standing. So you go around the breast and get all the way to the tail of the breast, which is at the
armpit.
At the armpit. Again, you examine that area. You may miss out some lump, but you may feel a swelling. If you find a swelling at the armpit or in any area, that is where you can have a clinical breast examination, get an expert, a doctor or a breast health nurse to check. So you repeat the same procedure on the opposite side, do the circular motion all the way without missing any area until you reach the tail of the breast at the armpit. If you do that consistently, you'll get to know how your breast feel, because your fingers would be doing all the checking, and what the breast may feel lumpy or otherwise, and especially if during the periods. So we always tell people, you need to do this at least a week after the periods. During the periods, the breast will feel very lumpy,
right,
and perhaps uncomfortable and even painful. So you want to do that a week later, 7 days later, 10 days later, when the hormones, have gone down, and it is much easier to get used to. So again, choosing a specific time is important. One can do it during a bath, immediately after bathing, but at least a week after your periods, so that things are settled. And for the men, you don't need to worry because you're not getting periods. You can just choose a routine, specific period to do that. There's being breast aware and aware of taking charge of your breast health. Yeah, obviously, as Daktari has said, if there's a normal discharge from the nipple, you are not breastfeeding, and you're having discharge from the nipple, that needs to be checked as well. Yeah.
All right. That is a very good education. That's a very good class.
Yeah.
Education class on how to self-check, self-examine the breast just for breast cancer or any lumps or any lymph nodes thereabout. But Mr. Makumi here talked about sometimes the healthcare is not well coordinated and there could be issues of misdiagnosis. Then how do you address that here, especially at HCG Center?
So normally, so first thing is when the patient comes, so we do clinical examination. So with that also we will be knowing what we are dealing with, whether it could be benign or cancerous. So any cancerous swellings, like we can think, like sometimes what happens at the biopsy, the cancer diagnosis is normally we run number of tests, including basic mammogram, ultrasound, which will detect the lump in the breast. From that we do something called needle test. It could be FNAC, which is fine needle aspiration cytology, We also do something called core biopsy, which is confirmatory. To confirm the cancer, we do the biopsy, core biopsy. So that
What is a biopsy?
Biopsy is it's a sampling procedure. It's a small procedure where they do an ultrasound. They locate the mass and they will take a small piece from it, okay, with the help of a needle. There is a instrument which will take a small piece from it without surgery. So then with that piece will be examined under microscope to look for these cancerous cells. We know how cancer cell looks and how normal breast tissue looks. So it can be confirmed cancer only after that histological diagnosis. So that is very must for diagnosis. So some patients like they are treated like a fibroadenoma. They think it is a benign tumor, benign lump, and they are missed. Okay? So what we do the diagnosis. We repeat certain imaging. Then in case it is still looking like doubtful of cancer, and the biopsy is telling it is negative, sometimes we advise to repeat the biopsy.
All right, and Mr. Makumi, when you look at the state of cancer support in Kenya today, we are seeing a lot of awareness, treatment. Where do you think that could be gaps that are still existing? Despite the awareness that is there, treatment, we have HCG Cancer Center, we have other facilities offering cancer care and treatment, but where are the gaps?
Yes, yeah, there is certainly a lot more awareness than there was, say, 15 years ago, but we are not there yet. We are still seeing far too many patients with the advanced disease, stage 3, stage 4. So, whereas there's awareness, there are still gaps in one, accessing the healthcare system. People still, live very far from health facilities out there. They may be having to take a 20, 30-kilometer walk to get to a health facility. So that is a barrier. But even when they encounter the healthcare system, then there is also awareness among the health workers. The fact that somebody is in an area where they are only seeing people with malaria or typhoid or other infectious diseases, they don't think much about cancer because that's what they see all the time. So that in itself is also a barrier because it means we have many missed opportunities to pick some of these patients early, and we don't because we are thinking about other diseases which are much more common. So by the time maybe we pick it up, it's late. But the other barrier, of course, financial barrier, financial access is also a big barrier. Cancer treatment is expensive everywhere, not just in Kenya, anywhere in the world. Cancer treatment is expensive, it is long, it is complex. So it's not like the way patients may get treatment, tablets for a week to treat malaria and it is over and done. Or someone will have a fracture, it is fixed, and in 6 weeks they're fine. This is a long, complex treatment, and meaning that there's significant out-of-pocket expenses. Even when you have social health insurance, the patients have to top up a lot very, very often. They also have many things that are not covered by the social health insurance. So in a country where we have very many people living in less than $1 a day, paying for some of these costs is expensive. And where we have a situation that patients have to debate between paying the rent, buying the food, or paying for the tests, it's a huge, really a moral problem as a country. We need to have some serious soul searching as a country because if a woman is thinking, do I feed the children or do I pay for the tests? Then we have a serious problem. So finance access is a big, big barrier. At Faraja, we try to mitigate that in our own little way by supporting some of the patients. We wish we could support everyone, but we can't because our funds are limited. That's a big barrier. But also access to specialists and expert care, like Dr. Adash here.
Right.
You know, we have made some strides, but then there are many areas where patients are not able to access, you know, a specialist, an oncologist. They would have an oncologist. They would have to travel, you know, maybe to the nearest regional cancer center. If they're in Garissa, that's a regional cancer center. But if they live in Mandera or Wajir or El Wak, they'll have to go to Garissa, which is, you know, hundreds of kilometers away. If you are in Lamu and the nearest cancer center is actually Coast General Hospital, that's a long, long distance.
Expensive
So
treatment, yeah.
geographical access is a big barrier to accessing an expert or a specialist, because they are not evenly distributed. They are unevenly distributed in specific centers. So patients may not be able to see a specialist and may take many, many months. And even when they see one, they may have an appointment that is so far to see a specialist. You know, you need to see a specialist, the appointment is 3 months down the road or 6 months. So that's also a big barrier. And obviously, it's excellent technology, world-class technology that they have, like they have at HCG, is not available everywhere. So you will always see challenges, say, in the public sector, where machines are broken down. We hear that in the media all the time, that the radiotherapy machine, maybe it's not working, a spare part is missing, or, you know, it's just gone down, meaning that the patients who are, for example, radiotherapy, will have to have an appointment that is again 6 months away, and the cancer doesn't wait. And so if they are going to have their treatment in 6 or a year's time, it means that disease is progressing. So it's a big barrier, availability of all these closer to the patients. So, but obviously there are also community level barriers, lack of awareness, you know,
Stigma.
And also our own traditional beliefs. You know, people will say, oh, I have this problem, I need to check, you know, mambo ya kinyumbani. We see, you know, people will visit their local herbarists or people like that, and they miss out on actual treatment.
And those are some of the misconceptions, right?
Yes.
That we have surrounding cancer treatment and care?
Yeah, they're part of those myths. You know, people may start looking for spiritual explanation, traditional explanations, or thinking like it is a curse, thinking like, you know, somebody has bewitched me. All those things are there. They are such a big reality in our communities. And there are also barriers, because people may go to find answers. By the time they are coming back to the hospital, the disease has progressed, yet they were trying to find other
alternatives.
Yeah, alternatives.
All right.
Yeah.
We talked about symptoms, and right now I want us to talk about causes of maybe breast cancer. What are some of these risk factors that we should be on the lookout for that maybe could predispose the ladies or the men to cancer, breast cancer?
So normally the risk factor for causes for any cancer is, we call it as multifactorial. So any cancer, to have any person to have any cancer, there are many reasons for it. Like exactly, like for normally we classify them into, like we have modifiable, non-modifiable. Like we have like hereditary factors, like which is again comes in non-modifiable, where like there are certain genetic mutations which runs in the family. Either it could be acquired during the patient's lifetime, or it could be passed through their parents, or it can transmit through their genetics. Like we have BRCA1, BRCA1, BRCA2 mutations. So which is seen in certain like 10 to 20% of patients, which is more in particular race, like Jewish group, like ladies, which is more common in them. So that is one thing. We have environmental factors. We have the physical factors, like their lifestyle factors, like we have excessive alcohol intake, we have smoking, we have obesity, lack of exercise, having children after the first childbirth after the age of 30 years, not breastfeeding the kids. We have like these factors. We have also certain like those ladies who have early menarche, like the onset of menstrual cycle, which is less than 15 years, and late menopause, like more than 55 years. Having less number of children, like all these are
Oh, wow.
like linked to, because it's a hormone-based disease.
That's a lot.
There are many risk factors we have, but it is not like that. These are the when we analyze on the number of patients who had breast cancer, these are the risk factors it was found to contribute in the onset of breast cancer. But it is not same for everyone. Like number of factors can contribute in developing the.
Usually we hear that early detection mostly could help with treatment and also just prevention of this disease. Then how early is early?
So you see, like we have early, like it has to be, we call it as localized disease when it is within the breast. Okay. When it is involving the nodes and everything, we call it as loco-regional disease or locally advanced disease. And when it is spread to the other sides, we have metastatic disease. The survival in early stages, we have around, like in Western world, it is around 99% of early stage breast cancer they're curable. Their survival is 99%, 5 years survival. If it is a locally advanced involving the nodes and everything, it can drop up to 85. And when it is stage 4, it can go up to 30 to 40%. So, like if it is picked in early stage, when it is within the breast, it is curable. It is early.
All right. It should be early.
As soon as the patient knows there is some lump, it has to be checked and it has to be diagnosed and started treatment immediately.
All right. And as we come to a close of this conversation, Mr. Makumi, maybe what do you think should be put into place to just help these cancer patients and survivors as well? Just to navigate, the things that they're going through in regards to support groups. I understand that this is already a support group for them, but how many are you in the country and what needs to be done to help these patients and survivors?
I think it's a collective call to action for all of us as a country, both at population level, as wananchi, but also at policy level. Whereas there's a lot of work that is happening in terms of creating awareness, and TV47 is doing a great job of doing that, this has to be sustained. The awareness about early signs, self-breast awareness, that is important component. Getting people to go for screening, in accordance with the national screening guidelines, getting people to go for screening, that's important. But also ensuring that at all levels of our healthcare system, from the dispensary level, essentially even from the community level, we have what we call community health promoters, CHPs, in every county. So these are important link to the community, because what I was demonstrating here on breast examination, that is something community health promoters would be able to
help with,
teach the community, but also important to navigate those who have a problem. So if, let's say there's somebody I taught as a community health promoter, they have a lump, they should be able to navigate them through the health system so that that lump is properly diagnosed to be sure what kind of lump it is. So we need to do a lot of work at grassroots level in creating awareness, but also in supporting those who already have breast cancer, so we don't stigmatize and isolate them. So community level, it also includes community groups, like faith communities. There's no reason, for example, our churches, our mosques, our temples, they should be able to have support groups for patients who are undergoing cancer treatment at that level. So they don't have to go for a support group in a hospital. They should have a lot more community level support groups. We do have some, but they are not widespread. They are
Right.
few and far apart.
Okay.
Yeah, so those would play a very important role in ensuring also patients comply and adhere to treatment. You know, we also have a big problem with the loss to follow-up. Patients just dropping off treatment. You don't know where they went. And community health promoters should be able to follow them and say, you didn't finish your chemotherapy, you didn't finish your radiotherapy, you need to finish, get them back to the system.
Okay, interesting. Now what is your parting shot for this? Is it a death sentence? What is the survival rate? How safe are they safe? What should they know even as they navigate the journey with breast cancer?
See, like nowadays, cancer, we call it as a chronic disease. Okay, so it's not like particularly when it comes to breast cancer, it's a curable disease. Okay, so early detection is the key. Screening and early detection is the key, which is screening methods are available widespread throughout the country. So awareness and knowing the anatomy of the breast, early detection, self-checking, early detection, like checking with taking the expert opinion if they have a small lump, if they feel anything abnormal. So it will help in early detection. With that, the chances of survival is very high. It's a curable disease. With early stage, we have survival up to 90%.
All right, there you have it. Now anyone can get breast cancer. This is not a one-gender disease. Both men and women can get it. Being a Breast Cancer Awareness Month, of course, we're being encouraged to go for screening. Do you offer screening at HCG?
Yeah, we do.
So right, we are at HCG Center. There you have it. You can come here and, you know, for your screening. Maybe I should have given you a chance to see where they can find HCG Center.
So HCG Center is located in Parklands on Shivaji Road, next to Fisher Hospital. Even our Faraja Center we have in our hosting in our HCG facility in Parklands.
All right. 2-in-1, you have it. 2-in-1 for your treatment and of course your care and support, the support that you need. That is Dr. Adash Chandra, clinical oncologist right here at HCG Center, and of course David Makumi, CEO Faraja Cancer Support Trust. Thank you so much, gentlemen, for hosting us and for allowing us to have this conversation on breast cancer. That's it. That brings us to the end of this conversation. You're watching Morning Cafe. Good morning.